Okay, Dr. Lebowitz, Long Island Gynecomastia Center in Long Island, New York. So I've got a touch-up today because we're back operating from COVID after a shutdown, and I guarantee my results. So if somebody says to me, Doc, I want a touch-up, I do it, no question asked. As a matter of fact, tomorrow, I'm supposed to do a touch-up in the afternoon. I got two cases, and the guy called me up yesterday and says, listen, I've been exercising even with this COVID. I've been home, and I look great, and my family and friends are just saying you're stupid. Do not do the touch-up. It's ridiculous. And so he called me up and he canceled. But this guy, we did his chest and his abdomen about a year and a half ago. And we did, the gyno. Now make a muscle. See there? He looks great. And he's 57. He's 57, so he's almost 60. And I think he looks great. The semilunaris, the median. I didn't etch his six-pack, really deep, because I think with him it would look ridiculous to have a deep, indented six-pack, because it's just not natural. If he was 21, maybe, but I think suck it in. You got the midline there, nice and tight. This is nice and tight. The semilunaris, a little bit of a six-pack here, and some nice volume to the chest. Lift up the arms. The scar, nothing. You can't even see the scar. Scar there, nothing, and the armpit scar right there, nothing. So he's thrilled with his front. Let's flip him over. So the back, he wants a little bit more work here. So we're just doing the back. All right. You had a little incision back here, but this is tight. So we're going to make the incision again. The old incision is there, and we're going to redo the lats here, right back here. And he wants this done better. So instead of making a hole here that we did, see that's tight, I'm going to do the old-fashioned way, make a little hole here, so I can use my curved cannulas and get all around here better. So it'll be really pretty much from here to here on both sides and here. I mean, he looks pretty good when he makes a muscle, but I'm gonna etch this a little bit better for him and get that a little bit better. And same thing here, etch this a little bit better and just get that better for him. And then over here. So touch up only on the back, and the little bit of fat I get out, I'll look at it, the quality of fat. If I can, I'll maybe put some up here, maybe, meaning I'll numb this up a little bit and just inject a little fat up there. I think that would be great, just to do that. So touch up only on the back. I did full body liposculpture on him a year and a half, 2 years ago, and we're gonna do down here and down here, because I guarantee my work. So let's mark them and let's hop to it. So this is the midline, right here, and this is kind of the shape of his butt here, just about here, right there, and right there. So what I'm doing, this is a touch-up of Vaser high definition. He's very happy with his front. I did, a year and a half ago, I did total body lipo on him. And now he's thrilled with his front and just wants a little bit of a touch-up on his back. So I'm vasering it. I'm putting on 80% Vaser rather than 70% because, number one, the back is thicker skin, thicker tissue. So you should do 80% from, first case, but since it's on initial cases, but since it's a redo, you always go up a little bit. There's just extra scar tissue. So the Vaser is emulsifying the scar tissue, breaking it up, which is very important in post-ops, in redos. Same thing here. I can feel the tip, but you don't want to go.
So you kind of split it up. You use that line
Yeah.
between the lower
and the upper. And what I call this the maximum point of indentation, meaning the waist goes down, goes out, in, out. All right, so this is micro air. And yes, there's more scar tissue on this side. It's all right. We'll do it. There we go. We got through it. Here we go with the smoothie. Oh, wait, that one's good. Here I'm on the right side, upper back, and I'm just sculpting the lats and the traps back here. So he has, when he, does an Arnold, move around, he's got some nice definition to his back. In a minute we're going to do the lower back. Okay, so he's on his side. Yes, I normally don't make this incision, so I keep my incision stealth in the groin by the belly button, but he's so tight here and so tight in the back that it's easier to do it over here. And this is a guy, so this is way below his bathing suit line, so nobody will see it. And it's like 2 millimeter big anyway. Now, so we're doing the lower back on this side to scoot some of the fat out and carve his upper butt a little bit. And I'll do a little fat injecting in there, just whatever I got, I'll put in. I want to fat graft the butt a little bit. So go right into my stealth incisions, right in there, so I can see where the tip of the cannula is.
Okay, ready? 3, 2.
So I can see where the tip of the cannula is, and I just want to give a little bit of a pop right there. A little bit of a pop right there. You all right?
I'm good.
A little bit of pop going on there. You all right?
I'm good.
There you go. The chest, it's a little bit more all in the muscle. This is more on top of the muscle because there's big veins going down. So you want to be careful with diving too far. And really, you just want to fat graft the upper butt. Again, you want the soccer butt look, not a big Brazilian butt lift. I did Vaser high-definition power-assisted liposculpture and Brazilian butt lift on an hombre, on a male. But with a male, when you do fat grafting to the gluteus muscle, you want to do the gluteus medius, the upper outer muscle. Because girls, you want the peach butt. Guys, you want that X. So you want that high lateral volume on the gluteus medius, so it's like an X, and you want that trochanteric, those hip dips on the guys, on the hombres. On the female, you just want big, round, and peachy. I got 2 liters of fat out of them, and I put in 120 cc's per gluteus medius, all under local anesthesia. You all right?
Yeah, I'm good.
Good, all under local anesthesia. And this was a touch-up. I did him about 1.5 years ago, and all he cared about was his back. So I did the upper back and the lower back. And the fat, instead of throwing it out, it's liquid gold, Long Island liquid gold. I used it to enhance his gluteus medius, to give him a soccer butt, a bubble butt that guys want. So if you have gynecomastia, if you want total body male-specific body contouring, you call me, Dr. Lebowitz, 631-424-0101, or email me at jonathanlebowitzmd@gmail.com, and I will promise you I do only male-specific plastic surgery. Call me and I'll take amazing care of you. Thank you and hope to see you soon.